Hi everyone, this is Ramalinga Prasad Kuppa. Welcome to my channel Pharma World. Today's topic is integration of ISO 9001 2015 into QMS, the quality management system as per ICH Q10.
Let us see what ISO 9000 prescribes. This international standard specifies the requirements for quality management system when an organization needs to demonstrate its ability to consistently provide products and services that meet customer and applicable statutory and regulatory requirements and aims to enhance customer satisfaction through the effective application of the system, including processes for improvement of the system and the assurance of conformity to customers and applicable statutory and regulatory requirements. Let us understand. The purpose of ISO 9001 is to specify the requirements for maintaining the quality management system. This is required when the organization needs to prove or demonstrate that it is capable of producing the product and provide the services of consistent quality always. The services include communications to regulatory, statutory agencies, and customers. So the aim of the ISO 9001 is obviously to satisfy the customer through effective application and compliance to the QMS, there is a quality management system.
Let us see how the ICH Q10 is comparable to ISO 9001. It says under section 1.1 of the ICH Q10 describes one comprehensive model for an effective pharmaceutical quality system that is based on the International Standards Organization. Quality concepts includes applicable good manufacturing practice regulations, and section 1.2 says the guideline applies to the systems supporting the development and manufacture of pharmaceutical drug substances, that is API, and drug products, including biotechnology and biological products throughout the product life cycle. See this particular point. What is QMS? QMS is for GMP. So ICH Q10 section 1.1 clearly indicates a comprehensive model integrating all classes of ISO 9001, which include GMP regulations. Approach of section 1.2 is towards product life cycle approach. Product life cycle means that as long as the product is being manufactured and services rendered. Life cycle includes evaluation of data or focusing the data from development, design, manufacture of drug substance and drug product. This particular point has to be noted for life cycle approach. Let us see how the ICH Q10 is enriched with regional GMP requirements, ISO standards and ICH Q7. Section 1.3 of ICH Q10 also defines the regional requirements, regional GMP requirements, the ICH Q7 guideline, good manufacturing practice guide for active pharmaceutical ingredients, and ISO quality management system guidelines form the foundation for ICH Q10. So if you see this particular point, the ICH Q10 is a combination or integrated part of all the guidelines, the regional GMP guidelines, the ICH Q7 guidelines, and the ISO. So ICH Q10 provides a harmonized model. Please note this point, a harmonized, it's a common model for a pharmaceutical quality system throughout the life cycle of a product and is intended to be used together with regional GMP requirements. The regional GMPs do not explicitly address all stages of the product life cycle. Example, development. The quality system elements and management responsibilities described in this guideline are intended to encourage the use of a science and risk-based approaches at each life cycle stage, thereby promoting continual improvement across the entire product life cycle. See how much information is there in this. So section 1.3 mostly focuses on regional GMP, the ICH Q7 and ISO 9001. This is a strong foundation of ICH Q10. ICH Q10 is a harmonized guide that integrates all the GMP requirements. The regional GMPs are generic in nature, so ICH Q10 provides very useful information explicitly on science and risk-based approach. For risk assessment, you may have to go through the ICH Q9 guide. That is not described here. So see, every time the approach is throughout the life cycle of the product. This particular point has to be noted. The life cycle approach is very important when you are developing a QMS.
Let us see how the guideline is compared by ISO versus ICH. ICH Q10 has 5 sections similar to ISO 9001. They are 1. Pharmaceutical quality system, management responsibility, continual improvement of process performance and product quality, continual improvement of pharmaceutical quality system, and glossary. ICH Q10 is similar to 9001, ISO 9001. All the 10 clauses of ISO 9001 are incorporated into these 5 sections. Let us see how the ISO 9001 works as per the PDCA cycle. PDCA means plan, do, check, and act. Clauses 4, 5, 6, and 7 of ISO 9001-2015 are context for plan. Clause 8 is context for do. Clause 9 is context for check. And clause 10 is context for act. 3 initial sections 1, 2, and 3 include scope of the ISO guide, normative references, and terms and definitions of the ISO guideline. So if you see this ISO works of the PDCA cycle, how these classes and context in the PDA cycle are given in detail in this slide. Let us do a comparison of both the guidelines in a nice tabular form. See, ISO 9001-2015 and ICH Q10 are compared with the comments. The context of organization, the clause number 4, is a part of quality policy, that is section 2.2 of ICH Q10, that gives an understanding requirements of customers. Leadership 5 clause, 5th clause, is a part of the management responsibility, that is the section 2 of ICH Q10. So entire information of the management responsibilities are articulated well in this. Planning of QMS is clause number 6 in ISO 9001. In ICH Q10, the continual improvement of process and products quality, the section 3, the continual improvement of the pharmaceutical quality system, section number 4. These two sections have the QMS elements described in well detail, very much details are there in that. So the 7 support section is also a part of the management responsibilities in ICH Q10. So the support structure of ISO is described in this section easily without any problem. Operations, performance, and improvements that is the section 8, 9 and 10 of ISO 9001 2015 are part of the management responsibility, the section number 2, the continual improvement of process and product quality, section number 3, continual improvement of the pharmaceutical quality system, section number 4. Almost entire operations, performance evaluations and improvements are well described and integrated into these sections. So if you have the ISO certification also along with other regulatory approvals, you can have a comprehensive integrated quality management system for all requirement, for all approvals. You need not have a separate system for ISO 9001. Try to work out this way to integrate your ISO 9001 into ICH Q10 for better results and effective compliance. I hope you understand the difference between ISO 9001 and ICH Q10 and the integration of all these three, the ISO guide, the GMP ICH Q7 guide into the ICH Q10 guide are understood well. Thanks for watching. For more videos, please do subscribe, like and share. Thank you.